Atrial fibrillation. Atrial fibrillation, also called AFib or AF, is a quivering or irregular heartbeat, arrhythmia. What is the normal heart rhythm? The heart pumps blood to the rest of the body. During each heartbeat, the two upper chambers of the heart contract, followed by the two lower chambers. These actions, when timed perfectly, allow for an efficient pump. The timing of the heart's contractions is directed by the heart's electrical system. The electrical impulse begins in the sinoatrial SA node, located in the right atrium. Normally, the SA node adjusts the rate of impulses, depending on the person's activity. For example, the SA node increases the rate of impulses during exercise and decreases the rate of impulses during sleep. When the SA node fires an impulse, electrical activity spreads through the right and left atria. It makes them to contract and force blood into the ventricles. The impulse travels to the atrioventricular AV node, located in the septum, near the middle of the heart. The AV node is the only electrical bridge that allows the impulses to travel from the atria to the ventricles. The impulse travels through the walls of the ventricles, causing them to contract. They squeeze and pump blood out of the heart. The right ventricle pumps blood to the lungs, and the left ventricle pumps blood to the body. When the SA node is directing the electrical activity of the heart, the rhythm is called normal sinus rhythm. The normal heart beats in this type of regular rhythm, about 60 to 100 times per minute at rest. What is atrial fibrillation? Atrial fibrillation, AF or AFib, is the most common irregular heart rhythm that starts in the atria. Instead of the SA node, sinus node, directing the electrical rhythm, many different impulses rapidly fire at once. They cause a very fast, chaotic rhythm in the atria. The electrical impulses are so fast and chaotic. The atria cannot contract and or squeeze blood effectively into the ventricle. Instead of the impulse traveling in an orderly fashion through the heart, many impulses begin at the same time. They spread through the atria, competing for a chance to travel through the AV node. The AV node limits the number of impulses that travel to the ventricles. But many impulses get through in a fast and disorganized manner. Irregular heartbeat. The ventricles contract irregularly, leading to a rapid and irregular heartbeat. The rate of impulses in the atria can range from 300 to 600 beats per minute. Atrial fibrillation can lead to blood clots, stroke, heart failure and other heart-related complications. Atrial fibrillation can also occur without any signs or symptoms. Untreated fibrillation can lead to serious and even life-threatening complications. The most common symptom is a quivering or fluttering heartbeat. Sometimes people with AFib have no symptoms and their condition is only detectable upon physical examination. Still, others may experience one or more of the following symptoms: general fatigue, rapid and irregular heartbeat, fluttering or thumping in the chest, dizziness, shortness of breath and anxiety, weakness, faintness or confusion, fatigue when exercising, sweating, chest pain or pressure. Are there different types of AFib? The symptoms are generally the same, however the duration and underlying reasons differ. Paroxysmal fibrillation is when the heart returns to a normal rhythm on its own, or with intervention. People who have this type of AFib may have episodes only a few times a year or their symptoms may occur every day. These symptoms are very unpredictable and often can turn into a permanent form of atrial fibrillation. You may experience a brief event, a paroxysm, of atrial fibrillation. It may pass without symptoms, or you may feel it strongly. It usually stops in less than 24 hours but may last up to a week. Paroxysmal atrial fibrillation can happen repeatedly. You may need treatment or your symptoms may go away on their own. When this kind of atrial fibrillation alternates with a heartbeat that is slower than normal, it is called tachybrady syndrome. Persistent AFib is defined as an irregular rhythm that lasts for longer than 7 days. This type of atrial fibrillation will not return to normal sinus rhythm on its own and will require some form of treatment. Long-standing AFib is when the heart is consistently in an irregular rhythm that lasts longer than 12 months. Permanent AFib occurs when the condition lasts indefinitely. The patient and doctor have decided not to continue further attempts to restore normal rhythm. Non-valvular AFib is atrial fibrillation not caused by a heart valve issue. Over a period of time, paroxysmal fibrillation may become more frequent and longer lasting. Chronic AFib. Sometimes it may lead to permanent or chronic AFib. All types of AFib can increase your risk of stroke. Even if you have no symptoms at all, you are nearly 5 times more likely to have a stroke than someone who doesn't. Causes of atrial fibrillation are: changes to the heart's tissue and to its electrical signals most often cause atrial fibrillation. To understand atrial fibrillation, it helps to know how the heart works. When the heart's tissue or signaling is damaged, the regular pumping of the heart muscle becomes fast and irregular. Most often, damage to the heart is the result of other conditions such as high blood pressure and ischemic heart disease. Other factors can also raise your risk of atrial fibrillation. 1. Changes in heart tissue. Usually the cells of the heart fire and contract together. However, when aging, heart disease, infection, genetics, or other factors change heart tissue, that pattern breaks down. This can happen because of A. Fibrosis, B. Inflammation, C. A thinning or thickening of the heart walls, D. Lack of blood flow to the heart, or E. An abnormal buildup of proteins, cells, or minerals in heart tissue. 2. Changes in electrical signaling. Usually, a trigger heartbeat sets off atrial fibrillation. Electrical signals from this trigger may then cause the heart to beat slower or faster than usual. Because of changes in heart tissue, sometimes, the signals create an atypical loop, telling the heart to contract over and over. This can create the fast, chaotic beating that defines atrial fibrillation. Variations in the heart's electrical signaling can be due to differences in heart anatomy, premature or extra heartbeats, normal heart rate adjustments, patches of faster or slower tissue, and repeated stimulation of certain tissue patches. What are the dangers of atrial fibrillation? Some people live for years with atrial fibrillation without problems. However, atrial fibrillation can lead to future problems. Because the atria are beating rapidly and irregularly, blood does not flow through them as quickly. This makes the blood more likely to clot. If a clot is pumped out of the heart, it can travel to the brain, resulting in a stroke, or to the lungs, causing a pulmonary embolism. Risk for stroke. People with atrial fibrillation are 5 to 7 times more likely to have a stroke than the general population. Clots can also travel to other parts of the body, kidneys, heart, intestines, and cause other damage. Atrial fibrillation can decrease the heart's pumping ability. The irregularity can make the heart work less efficiently. In addition, atrial fibrillation that occurs over a long period of time can significantly weaken the heart and lead to heart failure. Atrial fibrillation is associated with an increased risk of stroke, heart failure and even death. Complications. When it is undetected or untreated, atrial fibrillation can lead to serious complications. This is especially significant for African Americans. Whites have atrial fibrillation at higher rates, but research has found that stroke, heart disease, and heart failure are more common among African Americans. Some complications of atrial fibrillation include: 1. Blood clots. With atrial fibrillation, the heart may not be able to pump the blood out properly. It causes the heart to pool and form an abnormal blood clot. A piece of the clot, a type of embolus, can break off and travel through the blood to different parts of the body. It can block blood flow to the brain, lungs, intestine, spleen, or kidneys. Atrial fibrillation may also increase the risk of venous thromboembolism, which is a blood clot that forms in a vein. 2. Cognitive impairment and dementia. Some studies suggest that impaired cognition, Alzheimer's disease, and vascular dementia occur more often among people with atrial fibrillation. This may be due to blockages in the blood vessels of the brain or reduced blood flow to the brain. 3. Heart attack. The risk of a heart attack from atrial fibrillation is highest among women and African Americans. It is especially in the first year after atrial fibrillation is diagnosed. 4. Heart failure. Atrial fibrillation raises your risk of heart failure because the heart is beating fast and unevenly. The heart's chambers do not fill completely with blood and cannot pump enough blood to the lungs and body. Atrial fibrillation may also make your heart failure symptoms worse. Stroke. 5. Stroke. If an embolus travels to the brain, it can cause a stroke. For some people, atrial fibrillation has no symptoms, and a stroke is the first sign of the condition. If you have atrial fibrillation, the risk of a stroke is higher if you are a woman. 6. Sudden cardiac arrest. With atrial fibrillation, there is an increased risk that the heart may suddenly and unexpectedly stop beating if you have another serious heart condition. After a patient is diagnosed with atrial fibrillation, the ideal goals may include restoring the heart to a normal rhythm, called rhythm control; reducing an overly high heart rate, called rate control; preventing blood clots, called prevention of thromboembolism such as stroke; managing risk factors for stroke; preventing additional heart rhythm problems; preventing heart failure; getting back on foot. Things that can increase the risk of atrial fibrillation, AFib, include 1. Age. The older a person is, the greater the risk of developing atrial fibrillation. 2. Heart disease. Anyone with heart disease, such as heart valve problems, congenital heart disease, congestive heart failure, coronary artery disease, or a history of heart attack or heart surgery. 3. High blood pressure. Having high blood pressure, especially if it's not well controlled with lifestyle changes or medications. 4. Thyroid disease. In some people, thyroid problems may trigger heart rhythm problems. 5. Other chronic health conditions. People with diabetes, metabolic syndrome, chronic kidney disease, lung disease or sleep apnea have an increased risk of atrial fibrillation. 6. Drinking alcohol. For some people, drinking alcohol can trigger an episode of atrial fibrillation. Binge drinking further increases the risk.